everybody, it's Dr. Magnifico from JRSVet and Poppy.com. This is Zeke. He's about 3 years old. He came to us initially because he was straining to urinate, so he was going in and out of the litter box, trying to urinate and not producing any urine. So frequent trips to the litter box, discomfort when urinating, and small amounts of urine, especially in a male cat, are all pretty serious clinical signs. We really worry about these guys becoming blocked, so they get a urinary blockage and they can't urinate. Your bladder can only distend so much, just like a balloon, and then at some point it will rupture. That can be and should be considered a life-threatening condition. So he's had one trip to the ER already, which was a pretty expensive endeavor, and now he's having trouble urinating again. So she rushed him right in so that she could avoid the ER. He had a very small bladder, so he wasn't blocked. So I have another video on how to palpate, but the bladder lives really between the back legs. So for people who have cats with constant urinary issues, we train them how to palpate their own cat's bladder so they can understand what's going on internally to help better guide them as to what to do and how much of an emergency it is. So he had a very small, soft bladder that actually wasn't even that painful, but we got a urine sample and he had very bloody urine. So this is actually, well, not his urine, but it's a urine sample of hematuria. So very, very, very bloody. That helped us understand what was going on, so why he was going to the litter box, because it's so painful for his bladder to dilate that he's not holding urine. The most important thing to do is to do a urinalysis, so to check to see if we've got cystitis, which is inflammation of the bladder, or urinary tract infection, which is bacteria and white blood cells. You really need to do a urinalysis because you really need to understand what you're treating. It will help you with the immediate and the long-term care. So for him, he's going to go home because his mom is on a very tight budget. He's going to go home with fluid therapy. So for the really sick, blocked cats, we put them on IV fluids for a couple of days. They usually have an IV catheter and a urinary catheter. For her, because he's not blocked and he's not that bad, she's going to go home and do sub-Q fluids at home. So we send her home with a fluid kit and then show her how to do it to keep him diuresed. I'm going to put him on an exclusively wet food diet, a good quality wet food diet with water added to help try to continue to diurese him. And then based on his urinalysis findings, we will decide whether he needs an antibiotic or something for pain and inflammation. And typically I do the pain and anti-inflammatory anyway. So we're going to give her a short-term and a long-term plan and help guide her so that she doesn't have to go to the ER again. If you've got a blocked cat and you end up at the ER, the estimates can be somewhere between $1,000 and $3,000. If you've got a blocked cat here, it's about $800 to $1,200, but we are going to manage him on a budget today of about $100. So the fluid kit here is $25. He's got a non-steroidal anti-inflammatory, which is about $25, a urinalysis, which is about $50, and the exam is about $45. So that's our down and dirty cat with a urinary issue on a budget plan. But make sure you understand whether your cat has cystitis, which is about 50% of the cases, or urinary tract infection, which is about 50% of the cases. Don't just assume it's a urinary tract infection. Talk to your vet about causes, underlying issues, and how to manage it long term. This guy also coincidentally has barbering going on, so he is over grooming everything on his belly and then the backs of his legs. So I think he's either chronically stressed or he's chronically painful, and that's why he's over grooming. But that's a whole other separate issue. If you have any questions about this or anything else pet related, you can find me here at JRSVet or Poppy.com. Say bye, Zeke. Thank you.